Good day, everyone. I'm Aaron McIntosh. I'm the Director of Product Marketing here at ActZero. And joining me in today's fireside chat to provide some insight into unraveling the regulatory frameworks in the healthcare industry is Adam Mansour, our Chief Security Officer here at ActZero. Welcome, Adam.
Aaron, nice to be here.
So a couple quick housekeeping notes before we get started for those audience members joining us live today. At the bottom of your screen, you're going to see three important tabs. The first being the questions tab. That can be used to submit any questions during the session. The second being the attachments tab, place where you can find any resources that we're referring to, and those can be referenced, or those will be referenced during the presentation and available for you to download. As well, the rate us and feedback button. We're always looking to improve our sessions, understand what worked, what didn't, did we deliver the value we're hoping for? So please provide that feedback at the end of the session if you can. So to help mitigate the fallout of data breaches on citizens and businesses alike, governments and policymakers have introduced lots of rules and guidelines to help keep customer data secure. But these laws, frameworks, and policies, they tend to remain constant. They tend not to remain constant. They evolve with the threat landscape and are full of nuances and details, often making it really difficult to understand, manage, and apply, let alone stay compliant. Businesses have been increasingly saddled with numerous compliances, a few more than the healthcare industry. Just look at the payment card industry, the PCI compliance, the Healthcare Insurance Portability and Accountability Act of 1996, otherwise known as HIPAA, and the General Data Protection Regulation, or GDPR. And of course, there's lots of other state and local laws that apply. So Adam, let's start with a quick rundown of the current compliances and frameworks landscape that healthcare providers need to abide by.
Sure. Yeah. So the word framework basically means a collection of controls, right? It's supposed to give people kind of a simple to follow roadmap guidance, right? That's self-contained, right? So rather than saying, here's open-ended advice and it doesn't have a beginning, middle, and end, a framework is really something that you can adopt to say, okay, these are a set of controls that are geared towards a particular purpose that can essentially allow you to measure your own compliance or assess it yourself. Mm-hmm. Now, not all frameworks are created equal. Some of them are something that, you have a heavy influence on auditors, right? So some things like payment card industry, data security standards are really part of a larger ecosystem run by the PCI Council, right? So for credit card processing, for example, MasterCard, Visa, a collection of banks had been the ones that decide what the standard for people that take those cards and use them to process payments are supposed to do from an IT perspective to secure their environment. Now, of course, there's a way that you have to allow the vendors and the merchants and the people that are actually collecting to supply the information, right? And so that's where an auditor comes in, a qualified security assessor that's going to come in and basically collect the information if you're really big, right? So if you process a lot of cards, you're like Walmart, you're likely going to have level 1 merchant status. That's going to give you something like a QSA to come and audit you, right? Mm-hmm. And that's an easy one to sort of understand. Am I compliant or not, right? Because you're going to go through this process if you process these credit cards where somebody's going to come in and tell you whether you are, right? So you're going to pass. Right. There's a lot of other frameworks that don't give you the pass, right? Some of the bigger ones, too, with massive fines. If you think about general data protection regulation, right, it applies to a lot of companies. But the ICO, the offices within the EU that are handing out these fines, they decide who they're going to go after. There is a whistleblowing type program where you can alert that there's been a breach or some sort of malpractice against those 99 articles. But there's a whole bunch of legal and InfoSec officers running around there interpreting the controls for companies and trying to adjust privacy policies and data protection officers and give them training and understanding. So while there's 99 articles in the regulation, there's no formal audit to give you a badge that says, I'm GDPR compliant. You just do a sort of assessment and review. And then worse, if they come and basically send somebody from the privacy office to actually check, they can find reasons that you're not, following the regulation and then give you a fine, which is pretty steep, right? 20 million pounds and percentages of revenue, right? So they're not all created equal, not just in terms of what they're asking, right? It's not the same questions and it's harder or, less difficult for smaller or larger companies, right? Some it applies to all companies. Some it's based on size, like PCI. They don't really want to hit the shoe store that takes 2 credit card payments a year with a massive, QSA and expensive audit with all these technologies. they also don't want, in the GDPR case, to go after the little guy. If you look at how most of the finances are out, right, they're hitting, the Marriott hotels and British Airways and Facebook, right? They don't really want to come down necessarily. Not to say they haven't issued fines. It's just that they're funding this operation with these audits that are quite extensive, and they're trying to solve a very specific problem, right, to go where the volume of record capture and misuse is. So if you look at it in the healthcare industry, why do I bring these two up, right? You could be a UK healthcare practitioner taking sensitive data in. You could be a small one or a large one, and GDPR applies. You're not going to have an auditor to come in and tell you you're compliant, so you're always in a perpetual state of worry that something's going to happen, and now you have to follow these guidelines or get fined.
Yeah.
Alternatively, you could also be taking credit cards. Maybe in the attached drugstore, somehow you've decided that parking at the hospital is going to be done on a monthly basis as you're collecting credit cards there, right? How much before you have to audit and follow PCI? Well, there's very specific thresholds, right? So it's easy to know when to follow one or the other. Hard to know if you're certified, which you probably won't be, on either of those standards, right? And then you enter, the ones that you're probably most familiar with hearing, right? Which are the ones that you're sure applies if you take, you have EHR, electronic health records, or EPHI, right? Electronic personal health information, and saying, okay, well, I have systems that collect this stuff when people enter electronically or physically, and therefore the Portability Act is going to apply, right? And you usually always get that /HITRUST, but know that HITRUST is a third-party organization that creates a unified framework that has a lot of controls brought from a lot of other places to try to give you that certification that HIPAA doesn't by default, right? They want to give you a badge you can put on your website and wear with, pride, that says you've passed your HIPAA security compliant, and we've looked at it, and we're an organization that can be trusted, and they're going to be the ones that give you this sort of evidence package where you forward it to, whoever is going to ask, right? And so that's sort of a helpful third one. Now, this applies to content like credit cards and healthcare records. This also applies to PII, right? So you're usually getting a framework attached in many cases to that, but that's not true in every case, right? If let's say you're a VA hospital and you're working in a military base, and the Defense Industrial Base has said that as part of controlled unclassified information, you now need CMMC compliance, right? So you're a single entity, a healthcare organization. Maybe you have these other areas where you leave to go to the country. Doctors Without Borders, you're helping out in somewhere in Europe, right? You've decided to go to Poland and take an influx of things, and good for you, right? But now that you're taking in that information, GDPR, right? Pay by credit card, PCI, move through the controlled unclassified information about the soldier, healthcare information about the soldier. CMMC certification now applies, right? And so it's easy to trip over these the second you think about the jurisdiction and the type of data you're taking. And then there's things independent of that can help you actually follow a best practice, right? The Center for Information Security, CIS benchmark. I always talk about this. If you heard my other webinars, simple, practical advice on how to harden 0365. You don't get a badge, right? You don't get a certified mark there. But when an auditor comes and poke checks and says, how well is the configuration on this managed? You can say, well, we follow this best practice as defined by CIS, and here's the ways that we've kind of done it. So it's a very practical way of measuring it, where the other ones kind of go a little loose in terms of how they ask questions.
Yeah. And I think there's this belief out there too that a lot of these frameworks don't necessarily apply punitive measures. They're more there to kind of keep you in check. But I just pulled up some numbers last night on HIPAA. For the month of March alone, there were 43,229 complaints that were investigated. These either came through whistleblower or others. Of those, 68% had corrective actions, and 32 had no violation. So 68% chance. And the numbers looking back a couple months were very similar as well. Is like, you need to keep on top of this. Like this is critically important to your organization.
Yeah, I know with the ICO and GDPR, I mean, the money goes to the Treasury, right? And so you do have billions and billions of dollars that have been collected by this program to try to fund, better enforcement. And if you look at those statistics that you just mentioned, right, everybody wants to say, are they out for blood, or are they just going to do a nice walkthrough? In these programs, if there is a whistleblowing program, they're incented to try to get it, right? And if you look at CMMC, for example, a lot of people think the carrot is the benefit from having the certification of closing more deals in the defense industrial base. That's not the carrot, right? There is a stick. There is a whistleblowing fine in which the whistleblower gets 15% of what they've claimed. So, the money is definitely there to sort of capture what they can and make it so that they're getting these fines, because there's an incentive. A whistleblower has an incentive financially to do it. The GDPR and the Treasury and the EU has an incentive to line their coffers, and so too does HIPAA violations.
Yeah. No, it's definitely something to keep an eye on, and hence why I hope you're here today listening to this session. So the next question I have for you, Adam, is, addressing the specific regulations and controls that affect your organization. It's a little bit overwhelming, as we mentioned. So how can healthcare organizations streamline and prioritize those overlapping or conflicting control requirements?
Look, I think that a lot of these, frameworks ask the same question in different ways. It's hard to answer. Even they're not necessarily always going to conflict. They're usually asking the same stuff.
Yeah.
There may be a degree to which they're auditing that, right? If you go through a FedRAMP audit of your network, it's a very different audit than, your PCI or your let's call it HIPAA security rule, right? They're not going to go that detailed into, what protocols are authenticating users and what logging are you doing and how often are you dismissing addresses in your identity systems that are allowed through MAC address to authenticate, and is it a certificate? They're not going to go to those levels. So some of them will, right? And that's where, when you think about a unified compliance framework, asking the same question, you may have, frankly, to answer more questions up front, but at least then you've done your diligence to say, well, if for one reason or another I end up tripping over the requirements for another framework, they come to you, in May 25th of 2018 and say, oh my gosh, GDPR is enforced tomorrow, or today, actually, that would have been the day they enforced it. Do you have the controls in place? The number of people that I had actually talked to after the deadline that had said, I think this applies to us. And then when we did the discovery calls, we said, yeah, this does. You are collecting EU citizen data. You are something that can be fined. You're not extraterritorial. You do have a business office in the UK or the EU. This is going to apply to you. Is alarming, right? Same with CCPA, right? People sort of wait. They think of the published date, as in when it becomes the law, as the day to start practicing it. And it's like, you got to practice early. And this is true specifically of something like CPPA in Canada, where, for a long time, there's been no enforcement. Those enforcement fines are as bad as the GDPR. Yeah. And so they're angry. Their privacy office was angry at not being able to find companies like Facebook they thought were in violation of privacy terms, and had no ability to enforce fines on the company. And so they had to go to the Board of Trade and the Federal Trade Commission to try to get their fines. And so you can see they are incented to get the money. They are looking for tools to do it. And they are waiting until the day that it's active to be able to say, okay, let's go. No, they don't get retroactive money. Nobody can do that. You can't enforce a law that wasn't a law yet, but they can do it the day that it's live, right? And so if I think about the Unified Compliance Framework, it allows you to map out a whole bunch of things so that if you're unaware of how something may happen, or it may not be as big a problem you believe today, it really helps you to have that unified compliance framework, because GDPR, CCPA, and CPPA are virtually the same regulation in terms of the questions and the checks and balances that they have. So that can definitely help as a unified compliance framework, which is really just all the questions you'd ask of the top ones, and then just having all of that documented instead of doing each one in turn, right? To save time and energy on it. And even something like HITRUST is a unified compliance framework, not of everything I talked about, but of very many.
Yeah. So if we have organizations, a lot of our organizations are small to medium businesses. They're, kind of the mid-market size enterprise. If the question's there, if their efforts are limited, their budgets are limited, what should they focus on first?
I think, if you think about the specific things to look at first, you're always going to have technology and questions that you should answer first. First is asset management, right? Know your surface, be able to make changes, be able to control things that are in your responsibility, right? The last thing you want to do in IT is set something up that lives like an island that you can't get to very quickly. Endpoints are a great example, network devices, even your cloud systems. You should have a central form of control. And you can say, okay, well, if I need to install a new application or adjust policy or whatever, I have a quick button that I can press to do that, right? Because that's things that tend to get overlooked when you take Windows out of the box and set it up on a domain and then say, okay, I'm gonna leave it there, right? So asset management, very important. Knowing what you have, being able to control it, that gives you kind of at least an understanding of what you've got, right? And then you can start sorting and configuring things. So that's sort of always going to be step one, right? Step two is really to say, okay, well, can I monitor it? Can I adjudicate who gets on it and what's happening on it? So log monitoring, and then, identity management sort of 2 and 3, right? Like having those controls, right? Just being able to audit them. And you're usually even log monitoring is included in something like asset management, but it just gives you an idea of what's actually happening on those systems. Sometimes you're going to start combining, your big 3 prevention technologies: firewall, antivirus, email security. So, in between those stages, I'd say it goes asset management, prevention technology, logging and monitoring, and then of course things like identity management.
Yeah. And I think before you had mentioned to me one time that you kind of had like 3 rules when it came to this. I think they were something no more than a year, be able to benchmark, and tool volume. Can you run us through those a little bit?
Yeah, I mean, no compliance standard should take you more than a year to implement. Right? If it's taking you more than a year to implement, you've got foundational problems somewhere in IT. If you didn't do those things I just talked about, applying a compliance framework to you will likely take more than a year because you'll find foundational things missing. Oh, you can't do any of those corrective actions. We have no idea what assets we have. How could I do what this control is asking me to do, which is to update patches on them, right? Like if you just run into too many roadblocks, you really just didn't mature your organization with those other things to do it. So the litmus test is it's not the compliance regulation, it's your own maturity that probably got in the way of addressing it, because it should never take more than a year to do everything in there, right? Second, when we talk about, you should be able to benchmark your progress. If you can't count very easily the things that you've done, and you can't say, save this for later, do the next thing now, so that you can start to show progress, then you shouldn't even try to get it off the ground, right? One small thing at a time, progress reports, that's what these whole things are about, right? So it should never take you more than a year, and you should always be able to say where you're at: 47%, 60%, 10 out of 20, whatever the number you want to use is. You should be able to measure progress. And last, it's not about tool volume. Most of these things, frankly, they don't mention vendors. Almost all of them don't mention vendors. Outside of cyber insurance, who's actually paying if you get hacked, there's very few people that mention vendors, because they want to be as third party and agnostic to how you do this. They just need the job to get done. That said, no 2 vendors are created equally, and it will create a bit of strife for you if you start to use like open source or whatever, where you're trading labor for the money spent on the tool. But you shouldn't have to buy that much product. Outside of those core technologies I mentioned, most of these things do not ask for very sophisticated edge case products, intrusion deception, or CASBs, or any of these other magical data loss prevention tools. You're not going to find the expensive edge case tools there. These are going to be foundational things that probably existed for a long time, probably don't even need a product, usually can configure your assets to do this stuff by themselves.
Yeah. So, you had mentioned before, I think, asset management, log management. And I think when you're talking log management, you're talking like baseline security tools. So AV, firewall, anything else there that they should be taking a look at as kind of like those baseline measures?
Big 3: antivirus, firewall, email security, always going to be in there, right? That's almost always where you start after asset management, right? So asset management, big 3, log monitoring, identity management, right? Multi-factor authentication. You do those, things. That's a healthy looking organization, right? There's all kinds of other proactive things you could add to that, vulnerability scanning and all that other stuff. But if you have the right asset management tool and you're updating patches and you're hardening configuration against these benchmarks, right, the vulnerability scanner is more of a poke check on that, right? If you look at, edge case tools like we talked about, your data loss prevention and these other things, you're starting to go into the margins now, right? But foundationally, those are the things that are the right mix of tech that have to be in your environment, because without them, you are unable to achieve whatever's going on in the framework to reach a certain level of maturity where you can stay above basic cyber attacks, right? And the skills that you should have on staff to enable these things may not necessarily be able to take the tools to the nth degree, but having them even in a baseline configuration is important for all these things, because you will get an ask when there's a 0-day patch or some new patch, right, that you have to deploy through everything. You're gonna get an ask to say, can you tell me what Rick did before he left the company? There's going to be an ask to say, oh, we want to block these particular addresses because they're coming to attack us. Those are all things that are a regular operation task, right? And so these are foundational for that reason, is that you need them to conduct your day-to-day job, right? Otherwise, you're putting in hacks that just don't make any sense. So that's foundational, I think, and that's the right mix.
Okay. Now, I think I've come to the end of any of those questions I had for you. So as mentioned earlier, we did leave a little bit of time to look at audience questions. I do have one. It says, you mentioned VA coverage, federal coverage, and references to NARA for the COI health info. Can you go a little bit more into this?
Yeah, I think a lot of people don't know when CMMC applies and when it doesn't, right? If you think about the defense industrial base, hundreds of thousands of organizations, right? Everything from an Omaha chicken farmer that got a contract that's going to send, food to the troops abroad, right? And the information they have about how their chicken order is actually controlled and classified information, because it could mean a new and important person is coming to the base, right? Similarly with healthcare information, they created to know whether you have controlled and classified information, right? That's how you know you're in there. You don't necessarily have to walk in and be like, oh, I have a contract with who I know is the U.S. Army, right? You can very blatantly tell that that's a part of the defense industrial base. You may not know that you're actually part of it. So it's really about controlled and classified information. The NARA database, if you look up NARA, N-A-R-A, right, and say, I want to know if the information that I have or I'm collecting is part of controlled and classified information or controlled technical information or federal contract information, they'll give you a ton of examples. And so when I mentioned the hospital comment about, you now have CUI as a healthcare provider because that healthcare information belongs to a soldier, right? You can now see the link, right? Is that if you look on NARA and say health information, is this CUI? It'll tell you very blatantly all the examples, names, addresses, previous mental health history, all these things that show up there that tell you it's controlled and classified information.
No.
And therefore, CMMC applies.
Yeah, so this might be a question. It might be a little off. If you are not a VA hospital and you have like a veteran come in, do you all of a sudden by default have to be CMMC compliant, or are there rules around that as well?
Yeah, I think, check NARA for exactly what you're collecting about the person at the time, right? You think about the VAs, as Veteran Affairs is sort of, responsible for adjudicating things like healthcare coverage and things like that for veterans. So, when you think about, another hospital or somebody else that's just treating someone who is former or active military, right? Understand that the CMMC and all their different, requests for comments in the last version may have different exceptions. They may not necessarily come to you with certification requirements. You are supposed to self-assess and certify, right? I don't know that a whistleblower would necessarily say that that's something that, oh, you helped a veteran and they weren't part of, I don't think that's gonna show up necessarily. I don't think it's going to be a practice. I'm surprised at ways that they've whistleblowed in the past. But the concept is like, when is it going to be enforced, right? And so it's on you to go and figure out whether you have this information and to try to get these certifications. Right now, you're in a self-assessment period. I don't know that there's going to be whistleblowing between those two things. Certainly, there are no cases for me to reference as precedent of things like that happening to say that that's even a likely outcome. So I would say that your best bet is to say, check the information database in NARA, know if your controlled and classified information is in there. That makes you part of this ecosystem, right? That they want to try to start building more enforcement around and certification. And I'd say that if you're not a prime contractor or anything, you've got a while. You've probably got a year or two, or you're not servicing a prime contractor directly. You do not do healthcare work for the defense industrial base, the big agencies under the executive branch. Then you don't probably have a real push from management to do this. Yeah. But check the NARA database if you're an InfoSec practitioner and be like, oh, wait, we actually do.
Yeah. This goes back to the point about things being confusing and the nuances. And what I would like to say is, like, if you don't have a vCISO looking at getting one, make sure that you're getting the questions answered in advance. Otherwise, you might be standing in front of a panel answering them afterwards, and that doesn't necessarily work for anybody, and it can become quite a costly adventure. So, Adam, as always, thank you very much for your time. I know it's passed very quickly. To the audience members, thank you very much for sticking with us. I will mention that if you do happen to have concerns about supply chain management, Adam and I did do another fireside chat a few days ago, or a number of days ago now, on that exact topic. So please do go and check that out if you get a chance. I know we'll have a HIPAA tracker available for you as well. You will find that in the information. I think that may be emailed out to you later as well. Thank you again. Hopefully we've answered a lot of the questions, and don't forget to provide your feedback. Thanks all.